Good evening, everybody. My name is Han, or Coach Han, for the Arcanum Health channel, and today marks day 5 of 21 days of content. Today, I actually want to set up a protocol together. The husband of a good friend of mine actually pulled his back, and I felt extremely sorry for him, and so did his wife. She's also a very much a badass who knows her way around peptides, and together we set up a pretty sweet protocol. And to give you some insight in how we might go about designing this, I would like to make this video, or I'm actually making this video, with a big caveat. I'm not a doctor, I'm not prescribing anything, and if you start any protocol, please do your own research. Do not take my video at face value, and always inform and ask questions to your general physician or doctor before doing anything else. With that boring stuff out of the way, I tend to think about situations like these, like a pullback in a few stages. Acute phase, you're in pain, and that pain needs management. And how would we do that in case of a back muscle or a bicep or a shoulder? If it's a partial tear and or spasm, there are a few things really important. First things first, if you hit an 8 or a 9 out of a 10 pain scale, you need pain management. And we might not like pain management meds, especially in long-term situations, but in acute phases, they're very valuable, and that's also the reason I use them almost on a daily basis as an EMT. Things like acetaminophen or an NSAID like ibuprofen are gold. If they are able to take your pain levels from an 8 or a 9 back to a 4 or a 5, you're set. And you keep that in play as long as needed, and then you taper off. Other things to keep in mind are hydration, electrolytes, making sure that you have adequate circulating volume and that your electrolytes are at the right levels to prevent spazzing out again, I guess. And this is also where we make sure that, especially if it will take a bit longer to recover from, our nutrition is actually taken care of and set at baseline or maintenance. And we take out any insulting compounds and or stressors wherever possible. Throw your pre-workout away for the week at least, and start focusing on recovery. Short term, get back on your feet. Long term, usually maintenance for a week doesn't impact all that much, or might even help you lose weight. More on that later. From the acute phase, we roll into the recovery and healing phase. And this usually starts maybe the same day, depending on what happened, or the day after, or 2 days after the initial injury. And this is where our cool players can come to play, actually. We start with the basics, so adequate sleep, adequate hydration, adequate nutrition, of course. And this is also where we allow things like red light therapy or PEMF mats to take center stage. We want increased blood flow so we get increased nutritional delivery and get that recovery kick-started as fast as possible. In terms of peptides, we've got some really cool big players and well-known players. You've got your BPC-TB or the Wolverine stack to increase blood flow and actually deposits of those healing cells to the damaged area. And we have KPV as a player to reduce or acutely decrease inflammation. If we need more heavy hitters, so if recovery is like an extreme priority, especially in stuff like, especially untested, very important, untested sports, and you need to get back on that field, this is where we can start introducing things like HDH, maybe even low-dose insulin or a pegylated mechanical growth factor, but these are more exception than rule, and most people don't really need them. If we are starting or if we have kickstarted that recovery and healing phase, it's time to slowly start rolling, depending on your pain levels again, into the mobility and activation phase. And this is, well, the name says it, the place where you start mobilizing those muscles slowly. You're building new tissue, but you're making sure that you don't recover in that fully contracted and spazzed out state. By slowly increasing and doing mobility work, you're allowing that central nervous system of the body to slowly relax, which will eventually benefit blood flow in the end. So it will further speed up recovery. Pain will be your guide here. If you hit a 7 out of 10 on a pain scale, you're going too fast. If you hit a 1 or a 2, you're fine. A 3 up to a 4 is acceptable in my book, usually, but this also depends on the person. Once you can get some mobility in there, you can also start activating. And this is where cool things like a TENS device, which will allow you to isolate a muscle and activate it individually through small electrical currents, will come into play. And it's where you can further increase your red light therapy and your PEMF wands or mats to further decrease pain and increase mobility and further emphasize that healing factor. Once you are mobile enough, pain is next to gone, it's time to start thinking about strengthening. What caused your muscle spasm tear in the first place? And usually it's a muscle imbalance. People who train a lot in the sagittal plane often are very, very unstable when it comes to rotation. Think about the massive bodybuilder or power lifter that pulls his or her back when they are twisting around, grabbing something from the back of the car. Yep, I've been there. I'm nowhere massive, but still, I pulled my back doing that exact thing. Yay for having kids in the backseat of the car. Anyway, once you start strengthening those muscles, getting that rotational stability, which is often a problem, back into play, you make sure that such a thing never happens again. If you did things right, the painkillers will have long been gone and tapered out. You can slowly start tapering out your recovery agents and start building muscle rotation and keeping mobility and activation practices in play to make sure it doesn't happen again. I hope that was a cool insight. This counts, as I said, as day 5 of 21 days of content. I'm Coach Han. This is the Arcanum Health channel, and I will see you guys tomorrow. Cheers.